I'm being dispatched for a patient who's unresponsive. Arriving at the scene, scene is safe, PPPs are on. Nature of injury, unresponsive patient, no trauma suspected. I'm going to call ALS for backup. ALS backup for unresponsive patient, 609 Gold Street, Gallup, New Mexico. Out. My general impression, I do see a white male who appears to be weighing about 180 pounds, unresponsive. I do see a bystander, looks like it's the patient wife. I'm going to go ahead and ask some questions. Excuse me, ma'am. Can you tell me why we're here? What led to these events?
Well, I called 911 after I found my husband unresponsive. He was laying in the recliner.
Thank you. Patient is in the recliner, laying as you can see. Sir, can you hear me? Can you hear me, sir? Can you hear me? Patient is breathing but unresponsive. Check for pulse. Patient does have a pulse present. Check patient's airway. Airway is patent, free and clear of secretion. Patient breathing is normal. Going to assess further breathing. Equal chest rise and falls. Clear in all areas. Patient's skin is cool, clammy, and diaphoretic. Signs of poor perfusion, hypoxia. I'm going to go ahead and administer 12 liters of oxygen via non-breathing mask, but I'm going to maintain patient airway by adding an opiate adjunct. Check for gag reflex. The gag reflex. Measure from patient's earlobe to side of patient mouth. Patient accepts OPA. Bagging the patient at this point. I'm going to ask my patient to monitor bagging as I go ahead and get some interview or medical history from patient's wife. Excuse me, ma'am. When last did you see your husband normal?
I cannot say, but I know when I got back, he was unresponsive.
When last did you recall your husband having a meal, his last oral intake?
I can't remember at this point. All I know, I came back and he was unresponsive in the recliner.
Are there any signs or symptoms that you saw notice before he was unresponsive? Do you know if your husband has any allergies?
No known allergies that I know of.
Does he take any type of medication?
Yes, my husband takes insulin and Simvastatin.
So I guess he's diabetic. Any pertinent medical history you know about that you can help us with, or can you give us? Is he diabetic?
Yes, he's insulin dependent for diabetes, PVD, and hypercholesterol. But he's very compliant with his diabetic and with his meds.
Is he?
Yes.
I'm going to go ahead and perform a secondary assessment from head to toe. Checking patient's head. No signs of trauma. Patient's eyes. Equal even sizing of pupils. About 4 milliliters. Just reactive to light dilates. Patient ears. No bleeding. No signs of trauma there or abrasion. Patient's nose. No bleeding. Patient's mouth. Free and clear secretion. Again, no type of cyanosis with the mouth. Patient's neck, even trachea, no tracheal deviation. Patient's chest, no sign of vibration, equal rise and fall of chest with breathing. Pelvis, no signs of crepitus or deformities of extremity, abrasion. Abdomen, no distension at this point. Upper extremity, I'm going to do PMS. Patient's unresponsive, but I do feel a radial pulse, and for the feet, I do feel a pulse at the patient's feet. I'm gonna see, sir, can you hear me? Can you squeeze? Patient's not responsive. Patient's not responding. I'm gonna go ahead and do a further assessment. Assess patient vitals. Blood pressure. Blood pressure reading 100/60 within normal range. Patient's heart rate. 130 signs of tachycardia or perfusion. Oxygen. This patient is being bagged now 94%. Patient's temperature reads 96.8. Glucose. Patient responds to pain. No speech, no verbal. GCS score 6. Glucose reading 37. Patient's glucose is very low. I'm going to go ahead. Since patient's diaphoretic, cool, clammy skin, the signs of shock, I'm going to keep the patient warm. I'm going to ask my partner to change his breathing from a non-breathing mask and to administer a BVM at 15 liters of oxygen, 10 to 12 meters, 10 to 12 breaths per minute. Go ahead. Can you go ahead and bag patient? As patient is being bagged, I'm going to go ahead and call med control for standing orders to administer 15 grams of glucose to patient. It's med control. Patient, signs of hypoglycemia, glucose level 37 grams, 37 mg DL. Yes. Patient is unresponsive. Good with bagging. Yes. Patient level of consciousness is improving. I'm going to check to see if patient has the ability to swallow. Patient has the ability to swallow. Go ahead and administer. Yes, standing orders proof. Patient has the ability to swallow. I'm going to take a tongue depressor. Put my gloves on. Get my glucose tube. Squeeze some glucose onto the tube. Patient up. Open up patient's mouth. Take a breathing mask. Take it away. Breathing mask is off. Put the depressor between the gum and cheek line. Patient. Hold it on. Second set of glucose. Tube is empty. I'm going to go ahead and prepare the patient for rapid transport and reassess patient in the next 5 minutes. We're going to transport patient to the nearest hospital without siren and lights. Okay, load patient onto ambulance, stretcher, patient's in ambulance safely. Okay, I'm gonna go ahead and reassess vitals at this point. ABC's airway still remains patent. Respiration rate 20 breaths per minute. Possum, no signs of cyanosis or poor perfusion with patient skin. Patient skin looks to be within normal color. No signs of sweat and diaphoresis. Patient's blood. Pressure. 120/70. Reassess patient heart rate and oxygen level. 90 beats per minute within normal range. Oxygen without black mass 99%. We check glucose. Patient is sweating. Patient is alert.
Where am I? Where's my wife?
Sir, you are in the ambulance where your wife gave consent. She's right here riding with you. Okay?
Honey, it's gonna be okay. You did not have your glucose shot, and your blood was low, so they had to rush you to the ambulance.
A glucose reading 150. I'm going to ask my partner to continue with reassessing the patient as I go ahead and radio this report. Med 1, Unit 1, A23 ready to report. Med 1, Unit 1A23 responding to a call for unresponsive patient. Yes, for a 40-year-old male, white male. Yes, arriving at residence home at the scene, we found patient lying unresponsive in his recliner with no sign of trauma, sweating profusely with pale skin, signs of perfusion. Patient's wife reported that she found patient unresponsive on recliner, but could not recall when last she saw patient normal or patient last oral intake. She states that patient is a diabetic patient, is very much compliant with his diabetes. Vitals were taken. Patient's glucose level reading at 37 mg/dl. Signs of hypoglycemia. Med control was called to administer glucose and was approved. Prior to that, patient was administered 15 liters of oxygen non-breathing mask on the initial assessment. But as patient shows signs of shock, patient was administered 15 liters of oxygen BVM at a rate of 10 to 12 breaths per minute. OPA was added as an adjunct. Patient received 15 grams of glucose at 13:05 hours. Patient is now alert and conscious. Vitals are stabilized. Are there any other questions or orders for me at this time? If not, I will see you at 13:45 hours.